When a patient comes in for breast surgery, whether it's augmentation, reduction, or lift, I really listen to what the patient first describes as they're concerned, whether it's they're too small or too low, too big, and then try to build on that. I really like natural outcomes when it comes to breast surgery. I like when I call it the blessed look. I want a patient to see somebody they haven't seen in a long time and have that person go, wow, I wonder if, and not say, hey, where'd you get your boobs done? The breast consultation usually starts with me getting to know the patient. I like to find out what their cosmetic concerns are. The most important thing is usually the first thing they say to me. I write that down. It's the chief complaint, so to speak, that I want to correct with our surgical procedure. My measurements are really important for me for surgical planning. It's very easy to take measurements and select an implant or a size, whether it's going bigger or going smaller. But really I want to find out what she wants and provide her with something that she feels comfortable going home with and living with every night for the rest of her life. I always tell patients when you're having a procedure, whether it's an augmentation, a reduction, a lift, I think that surgical risks are omnipresent, and you have to accept the risk as if they're your own. However, I always tell patients when they sign the informed consent, don't be alarmed by what they're reading. I'm there for them. I'm always going to be there for them. If something goes wrong, thank God it happens few and far between, I'm not going anywhere. I take care of them. I'm their doctor. Downtime for breast surgery depends on the procedure. Usually a reduction and a lift tend to have less downtime than, say, a primary augmentation. But most patients are getting back to their normal activities in, say, 2 to 3 days. A common quote that a patient would say after surgery is, "It's the greatest thing I did. I just wish I did it sooner." Whether you're talking about a reduction or an augmentation, a lift, in general, the outcome and satisfaction rate is very, very high.